Hey guys! Today, we begin with one of the most important parts of history taking, that is history of presenting illness, or HOPI. To understand this topic thoroughly, we'll break it down into parts. In today's video, we'll focus on the basics of HOPI. HOPI is a detailed chronological description of the patient's chief complaint, from the time of onset to the current status. In simple terms, you start from the day the patient first experienced symptoms and describe everything up to the present day. For each complaint recorded, we need to elaborate in detail and also include any associated symptoms. The purpose of HOPI is to help narrow the differential diagnosis, understand disease progression, assess the impact on daily life, and reveal associated symptoms, previous treatment attempts, and the patient's concerns. We elaborate on each complaint using the ODPAR format, which stands for onset, duration, progression, associated symptoms, and relieving or aggravating factors. Let's begin with O, onset. This describes how the symptom began. Onset can be of three types: sudden, gradual, or insidious. Sudden onset means the symptom starts abruptly, within seconds to minutes. This is often seen in vascular, traumatic, or acute infectious causes. For example, stroke presents with sudden weakness on one side of the body. A myocardial infarction, or heart attack, presents with sudden chest pain at rest. Gradual onset refers to symptoms that develop slowly over hours, days, or even weeks. This is common in chronic, inflammatory, or degenerative conditions. For example, tuberculosis typically presents with a gradual onset of cough and weight loss over weeks. Osteoarthritis presents with joint pain that worsens gradually over months. Insidious onset means the symptoms developed so slowly and subtly that the patient may not have noticed them at all. This is typical of many chronic conditions. For example, diabetes mellitus and chronic kidney disease often present this way, with patients unaware of symptoms until complications develop. One important point to note is that you can and should ask leading questions to help the patient recall details and clarify the nature of the illness. Now we move on to D, duration. This refers to how long the symptom has been present. If the symptoms have lasted for less than 2 weeks, we call it acute. This is commonly seen in infections, allergies, or vascular conditions. For example, burning micturition for 3 days in urinary tract infection, or sore throat for 3 days in acute pharyngitis. If the duration is between 2 to 6 weeks, it is termed subacute, as seen in conditions like infective endocarditis or subacute thyroiditis. When symptoms persist beyond 6 weeks, or in some references, more than 3 months, we call it chronic. For example, a chronic cough for years in a patient with COPD. Next is P, progression. This describes how the symptom has evolved since it began. Different diseases show different patterns of progression. There are 4 main types. First, progressive or worsening, where symptoms gradually increase in severity or frequency. This is seen in conditions like cancer or heart failure. Second, regressive or improving, where the intensity of symptoms decreases over time, either spontaneously or due to treatment. For example, fever in viral illness resolving on its own. Third, static, where the symptom remains unchanged in intensity, such as a mild headache that has neither improved nor worsened over 3 days. And fourth, intermittent or relapsing remitting, where symptoms come and go with symptom-free intervals in between. A classic example is migraine, where a patient has repeated episodes of headache but feels completely normal in between attacks. Moving on to A, associated complaints. These are symptoms that occur along with the main complaint. They help support or rule out certain diagnoses and can suggest systemic involvement or complications. A good way to ask is, did you notice any other symptoms along with this, or is there anything else bothering you? For example, a patient presenting with fever may also report rash and joint pain, which could suggest dengue. Or a patient with chest pain may also complain of breathlessness and sweating, which could suggest a myocardial infarction. Finally, we have R, relieving and aggravating factors. These are things that make the symptom better or worse. They can help distinguish between mechanical, inflammatory, and functional causes of illness. Ask questions like, is there anything that makes it worse, or does anything provide relief, like a specific position, medication, or time of day? For example, chest pain that worsens on exertion and improves with rest suggests angina. Pain that worsens when lying down but improves on sitting up may indicate pericarditis. Joint pain that improves with activity suggests rheumatoid arthritis, while pain that worsens with use and improves with rest points to osteoarthritis. Also consider diurnal variation when relevant. For example, fever that rises in the evening is common in tuberculosis. Asthma tends to worsen at night or early morning. Morning stiffness that improves with activity is a classic feature of rheumatoid arthritis. That concludes the basics of HOPI using the ODPAR framework. In upcoming videos, we'll apply this format to actual cases to help you build strong history-taking skills. Thanks for watching.